It has put more pressure on people because all these lockdowns, all these changes in behaviors, like not being able to go out, having to work from home, doing everything like we are via Zoom, has put a lot of mental pressures on people. And as a result of that, individuals turn a lot to, online social media, online gaming, watching TV. It's become very insular. And as a result of that, people don't have that physical community that they can depend on. The lack of physical face-to-face interaction has definitely put more pressure on people emotionally, mentally, given them less avenues for finding the support structure.
I feel like COVID has definitely made me realize the importance of having services in place prior to such events occurring. And it's made me see the way that mental health can, even in people that, were the healthiest mentally and things like that, how they can be impacted by such things.
Completely changed and revolutionized the way that I think about mental health. For me personally, I did not realize the extent to which I had actually suffered from mental illness all my life until the pandemic hit, until I was forced to be at home. I had no distractions, nothing to do, nothing to distract myself from what I was actually feeling or experiencing. And I was just there with myself, and I had to face some pretty harsh realities of what my life actually has been up until then, and analyzing certain experiences and behaviors and the way that I've reacted to those experiences, and how some of that was actually quite unhealthy and actually didn't really serve me, but also acknowledging that some of those things I didn't have control over, and that was mental illness that I was not aware of at the time. I personally did not realize that I had PTSD, that I had anxiety, that I had depression. For a while there, I really thought that I thought I was depressed for a few years in high school. I kind of got out of high school and I was like, oh, I was not depressed. I wasn't depressed. That wasn't depression. I was just being dramatic, but that was just me gaslighting myself. And I think when it really came to the pandemic and I was there by myself, just thinking about everything, it was, wait, actually, Marcel, you were suicidal, and that didn't come out of nowhere. That wasn't you being dramatic. That was you actually going through something that did impact you at the time. And then you can kind of see the flow-on effects of how that then impacted different things in my life. So I think in the pandemic, it really showed me that mental health is super important. Understanding mental illness is super important, and understanding how they can interact, for me personally, was completely revolutionary, because now I can manage my mental illnesses in a way that I hadn't been able to before, which is a little bit concerning that it needed a pandemic of not doing anything to kind of realize all that. But I also think it kind of speaks to how a lot of us do use general life as a distraction from certain things, and when we don't have those distractions anymore, we are just left with ourselves and what we're feeling in our brains.
Now that we are stuck at home, because we don't have that escapism of going outside or meeting our friends or playing, for example, footy, we don't have those escapisms. Because of that, we hold a lot of things in. And I've realized that, crap, at the end of the day, no matter what's externally going on, you have to look after what's going on inside. And so I think for me, it's gone up a level where I need to really look, put mental health on a pedestal and look after myself along with my physical health.
Being physically separated from my family has been really challenging. I'm from a really large family. I've got 5 siblings. I've got a lot of nieces and nephews, and my parents aren't actually in Victoria at the moment as well. I feel like I kind of go through a bit of a up and down roller coaster of that kind of motivation and losing levels of drive. I think that really ties into university as well. I can definitely put my hand up and say I've had some really great semesters where I'm really motivated continuously. And I've also had some semesters and some subjects that I've dropped the ball, or I just don't feel as motivated to continue on with that drive. So yeah, I think those kind of 3 areas have been quite the challenge, like most people.
more than ever, so many people are needing support, feeling quite low and fatigued. I'm knowing myself and also my friends and family are feeling it right now. And I feel like there is so much pressure of being a frontline worker. You're actually experiencing firsthand how difficult it is to support individuals, such a massive pressure on wait lists and trying to support someone and also feeling the same way and trying to give that energy. So I feel like with COVID especially, it's amplified so much as what we're feeling, and we're feeling it more and more, and it's just putting a strain on so many other outlets. It's becoming a domino effect, and it's just putting so much pressure on everyone.
From listening to clients, it sounds like we've had 18 months of craziness, to put it lightly, particularly in the current lockdown 6. There's been a real shift for people in terms of feeling quite depressed. We hear a lot of loss of motivation, loss of joy in things that used to interest you, those kinds of symptoms. Whereas before lockdown 6, there was a lot more stress and anxiety that we were hearing about, and people were more worried about the future and struggling with stress in the present day as well. For our clients, it is that COVID has really triggered some mental health issues for the very first time. It's really around stress, social isolation, worrying about the future, feeling depressed. And for others, it is that COVID has really exacerbated some mental health issues that were already there, because people can't maybe use their usual coping strategies. Feel that we're all impacted to some degree. And it's really important to just normalize that and validate that for everyone at the moment going through COVID.
So uncertainty is really dominating at the moment, and then it influences many things. First of all, we cannot plan our future or even tomorrow, even next week. So everything will be determined by how things going on during the pandemic, rather than I'm planning something to do over my life. So that's one of the critical aspects why I feel stressed out. It's more like you're living under emergency situation every single day.
You're seeing people in different places, in different points of life and different walks of life. And then you're going to compare yourself more often because you have more access to that. I don't think people were comparing themselves as much when they had, the Telegraph. For instance, like we should definitely look into healthier ways to use up our time, especially in things like pandemics, like the one that we're in right now.
From TikTok and Reels, there is a lot more self-diagnosis happening around mental health conditions or mental health disorders, which, although it can be super helpful because it's another form of education and another tool of insight, I think when we've been stuck inside and locked away from our broader social groups and going through, this collective hardship, it can maybe be a misguiding form of assessment because people are struggling so much already with just a change in their normative emotional state and their way of living that I feel like relying on social media as your diagnosis tool isn't super productive all the time. It can be a great starting point, but when people come to depend on it, I think that can be quite problematic. And so I think making sure that people understand that you still need professional guidance and professional help to fully understand your mental health is very important, particularly during COVID.
Yeah.